In 2024, venture capitalist Brian Johnson, the man spending millions to live forever, visited a clinic in Honduras to undergo a procedure he called the most extreme medical intervention in history. He wasn't getting a surgery, he was receiving follistatin gene therapy. For decades, the idea of myostatin inhibition was a myth whispered about in bodybuilding forums. The promise to delete the biological brakes on human muscle growth. But as a physician, when I see millionaires flying to the Caribbean to bypass the FDA, I don't just see innovation, I see a massive physiological gamble. Today, we're going to look at the science of follistatin 344, the data from the Honduras trials, and why your heart and tendons might be the ones paying the ultimate price for your gains. So, to understand follistatin, you have to understand myostatin. Think of myostatin as the governor on a Ferrari engine. It's a protein that tells your body stop growing. We have enough muscle. People born with a genetic myostatin deficiency and animals like the Belgian blue cattle don't have this break. They are hypermuscular by default. Follistatin 344 is a truncated isoform of a naturally occurring glycoprotein. Its job, it acts as a decoy. It binds to myostatin and activin A before they can hit the stop button on your muscle cells. Unlike testosterone or SARMs, which primarily cause hypertrophy, making existing fibers bigger, follistatin has been shown in animal models to also trigger hyperplasia. It's the creation of entirely new muscle fibers. It's not just upgrading your current engine, it's adding more cylinders to it. Now, this isn't just theory anymore, right? A company called Minicircle has been running longevity trials in a special economic zone in Honduras. They use plasmid gene therapy, a non viral way to instruct your body to produce its own follistatin. The preliminary data claimed participants saw a 2 pound increase in fat free mass and a reduction in epigenetic age by 12 years in just 3 months. That is amazing. But here's the catch: these trials are happening outside of standard clinical oversight. While high profile biohackers call it the frontier of human evolution, as an internal medicine specialist, I look at these numbers and see a massive red flag. The rate of change. Your body was not designed to add structural mass at a gene edited pace. This is where the biohacker and the physician disagree. In my practice, we talk about the engine versus chassis mismatch. Your muscles, the engine, can adapt to new stimulus in weeks, but your tendons and ligaments, the chassis, this take months, sometimes years to strengthen through mechanical loading. Follistatin 344 accelerates muscle density so rapidly it can outpace the tensile strength of your connective tissue. We're already seeing an uptick in tendon ruptures in the TRT community. You can see about that in this video here. Imagine what happens when you add a gene doping agent that bypasses myostatin. No brakes. You're putting a 1,000 horsepower engine in a frame designed for a sedan. Eventually, something will snap. And then there's a bigger issue. There's the heart. Your heart is a muscle. If you're systematically inhibiting myostatin, what is stopping the myocardium from thickening pathologically? We don't have long term human data on cardiac remodeling with FS344. What we do have from the clinical trials for muscular dystrophy is a clear signal: LDL cholesterol. Roughly one third of subjects saw an 8 to 10 milligrams per deciliter rise in LDL. In the longevity world, we call this trading years for gears. You might look like a god in your 40s, but you're accelerating the clock on atherosclerosis and cardiovascular risk. Is follistatin 344 the future of medicine? For patients with Becker muscular dystrophy, it is a miracle drug. But for the healthy professional looking for a shortcut, it is a high risk, low data gamble. We don't need extreme procedures to get elite results. We need clinical stewardship. If you're interested in performance optimization that respects your long term health, don't fly to the Caribbean for a plasmid injection. Start with a physician led baseline. Look for a serious physician that can go over the risks and benefits of any treatment that you want to try and guide you through your own health journey. I'm Dr. Lasso, and I'll see you in the next analysis.